My husband and I have lived in Pembroke for over 15 years now. We loved it when we first moved here, and it just keeps getting better. So much good news comes out of Pembroke. We've created exceptional schools, award-winning businesses, wonderful parks, libraries, and historical buildings, and important services like the Pembroke Emergency Management Agency. And hey, we have Tiny & Sons. But what I love most is the pride we share in our beautiful town. And pride is contagious. The more I see our citizens joining together to improve our town, the more I'm inspired to be a part of it. I look forward to rejoining the Board of Health to keep residents safe from disease. A very real danger is Lyme disease. We need to do more to prevent, identify, and treat this serious threat. I'll ensure Pembroke joins the multi-town consortium created by Lyme disease expert Dr. Thomas Mather. The addiction epidemic is a tragedy. There's no stereotypical drug addict. Painkillers are overprescribed, way too accessible, and lead to addictions anyone can succumb to. Maybe it's sunk its evil teeth into someone you love, or maybe even you. I'll do everything I can to prevent this monster from getting a grip on any more Pembroke families. Inpatient treatment is crucial for recovery. We should never underestimate the pain of withdrawing from these horrible drugs, and I'll use all available resources to find more places to accommodate real healing. I'll work with Board of Health member Donna Bagney, the Pembroke Titans Against Drugs, and the school committee to spread opiate abuse awareness. The Plymouth County Drug Abuse Task Force is hosting a conference on the opioid crisis May 17th. Parents, teachers, coaches, and many others can learn how to better recognize the warning signs and stop it in its tracks. I'll encourage more workshops like this. Once the physical aspect of withdrawal subsides, a lifelong battle begins. More counselors and support groups will help people stay clean for the long run. Knowing you're not alone in your struggle is key to success. I'm confident that Pembroke has the compassion to care for those suffering from addiction, and together we'll create strategies to face this problem. A precious resource is our waterways. I'll continue to keep them clean and safe. Did you know a century ago Brockton gained rights to drain water from Silver Lake? I'll work with the Plymouth County Water Commission and the City of Brockton to revisit this agreement and lessen the negative impact on Pembroke. I'll apply for CPC grants and continue to improve our public beaches. Play equipment, water bubblers, beaches, and picnic tables benefit everyone in town. I encourage everyone to enjoy our ponds using public access areas. At the Taste of Pembroke, I met a woman who owns a pizza shop here. She told me that her experience with town officials and the health agent was such a positive one that she's considering making her home as well as her business in Pembroke. And I was so proud to hear that. Now, I don't expect you to remember my last name, Citranovsky, and I sure won't ever ask you to spell it. But please, when you vote for the Board of Health, just remember, I'm with Liz. Thank you.
Hello, my name is Gail McSweeney. I'm appearing before you today to ask for your vote in 3 weeks for a seat on the Board of Health. From 2007 until 2010, I had the pleasure of working as your principal clerk in the Board of Health. My position was funded through the trash and recycling accounts. Halfway through the fiscal year of 2010, the residents received an increase of $30 in their bill to finance my position. However, this was not enough to sustain the account, and my position as principal clerk was eliminated in March of 2010. This was one of the many changes in the board. Wilson Whitaker, a longtime and devoted board member of over 20 years, left the board to join his wife in Lakeville. In June of 2009, Lisa Cullity, then clerk of the Board of Health, nominated my opponent, appearing in front of the selectmen on June 9, 2009, for Ms. Citranowski to replace Wilson Whitaker as member of the board. Another big change to the office was when our prior health agent, Frederick Leary, became ill in 2009. He was terminated from the Board of Health in October of 2010 after serving the town for over 15 years as our health agent and many other years of service prior as an active presence in our recycling center. It has come to my attention that currently the Board of Health has lost sight of certain duties the board must perform. I would like to speak to you specifically about private well records. For the past 2 years, these records have been unable to the public or town employees. This is a major safety issue that needs to be addressed. Without being able to check the location, distance of septic or well to be installed or already existing, cross-contamination is a very real danger. Last year, I had the pleasure to speak with the chair, Donna Bagney, about the inability to retrieve the well records. Donna stated to me that the board had never changed its policies and was unaware they were unable to retrieve these records. With the changes to the Board of Health office and no guidelines for the board to follow, our current health agent, Lisa Cullity, has had the burden of guiding the board. However, this is not how the Board of Health is intended to be ran. The board members are to oversee the financial spending, the state and the town laws are being implemented as they should be, in the oversight of the office staff. In closing, I strongly believe, based on my experience in the board, that there needs to be a set of guidelines that dictate both normal and situational operations of the board. And without these guidelines, the board cannot carry on its duty to the residents of the town. I urge you to please vote May 14th, and thank you for your time.